Our next speaker is Dr. Stephen Stankevicius. He is currently a psychiatric registrar training at the Royal Brisbane Hospital and has completed a Bachelor of Science majoring in nanotechnology at the University of Queensland, before continuing on to study medicine at the same university. Stephen is currently writing a book on free will and its implications for psychiatry and society. He was a featured presenter at the 2014 RANZCP Philosophy, History and Ethics of Psychiatry seminar, and regularly writes about psychiatry, psychology, philosophy, consciousness and well-being for his blog. Steve.
Thank you, John. Can everyone hear me okay? Yes. Alright, so today I'm going to talk about the illusion of free will, and so the illusion of free will, how it relates to psychiatry, and ultimately why this matters for us. So I want us to all start by getting you to consider your current experiences right now. So you've had the self-control that's allowed you to sit here all afternoon, listen to talks about psychiatry. You may have a career, friends and family, and hobbies. But what if this all started to change? You started to experience intense episodes of rage and aggression, your relationship with your spouse deteriorated, and you lost your job. And a month later you have a seizure and are rushed to hospital. The result in head scan reveals a tumour in your brain that can not only account for the seizure you've just had, but also your recent profound personality change. So the question I put to you is this: would you want this tumour to be seen as an inherent part of who you are, or would you want treatment? Would you like to be blamed for your recent indiscretions, or would you like the kindness, compassion and understanding that you're a product of your biology and circumstances? Well, I think that we're all blaming people for essentially the same reason every single day. And although we do not all have brain tumours, this is merely an obvious example of the neurophysiology of our brains that give rise to thoughts and actions. Now, the illusion of free will, the idea that our minds are free to wander independent of the brain, is allowing this animosity that we feel towards others. So, whilst we agree that we shouldn't blame someone for having an ugly shape nose, we feel entirely justified in blaming someone for their brain and resolved behaviour. So, specifically for psychiatry, I think the illusion of free will is contributing to the stigma of mental illness. It's responsible for the shame that mental health patients feel about their own illness. And it's also negatively impacting on how psychiatrists view psychiatric pathology itself. So not only do I think that free will is an illusion, I think it's a dangerous illusion. And if we all truly aspire to build a better world in psychiatry for tomorrow, I think we can start by acknowledging this today. So when I was first introduced to psychiatry as a medical student, I was astounded. So here was a group of doctors breaking down human nature, identifying maladaptive behaviours and attempting to treat them. So crazy people weren't just crazy. They were suffering from psychotic illness with a number of different causes and diagnoses. And sad people were not just mopey individuals, they had depression, again with a number of different causes. So family history, early childhood experiences, drug abuse, vitamin deficiencies, neuronal antibodies. It seemed that the closer one looked, the more reasons that you could find to explain why someone thinks and acts the way they do. And I was excited about this. So if someone was thinking and acting in a way that was a detriment to themselves and people around them, that theoretically be causes that we could identify and hope to rectify. But unfortunately, there seemed to be an arbitrary line drawn in the sand. And on one side we had psychiatric illness, and on the other side we had what simply one chose to be like. So on one side we had understanding, treatment and management, and on the other side we simply had blame. And where this line in the sand was drawn tended to change from doctor to doctor as well. So is depression an illness or a choice? Well, luckily most of us now would agree that depression is an illness. But what about the alcoholism in that person? What about the personality vulnerabilities that causes them to have unstable relationships? What about their propensity to go to the casino every week and lose half their paycheck? So what part of people have explanations and which are merely chosen? And if some parts are deemed to be merely chosen, where do those choices come from? Do they come from thin air or do they come from somewhere else? And it's questions like these that led me down the rabbit hole of the philosophy of free will. and it's profoundly changed my outlook on life and psychiatry, and I think it had a similar effect on anyone else. So, what is free will? Well, free will is the notion that we're free to alter our thoughts and actions at any given moment. And this is essentially entails two assertions. So the first one is that we could have done differently than we did in the past. And not due to some random occurrence, but because you as a conscious author chose differently. So although I had cereal for breakfast this morning, I could have had toast. And although you drove your car to work last week, rewind the clock, you could have called the bus. Now in addition to this, free will also implies that you as a conscious agent, so felt sense of self, the me and I that's riding around inside your head, is the governing force when making these kinds of decisions. So you feel you want to think a thought, and then you think it. So you're in the driver's seat, you're doing it. Now it certainly feels this is how we conduct our lives, and there's been multiple cross-cultural studies that have shown that this is a pervasive intuition. So it's an assumption that we've all made about ourselves and everyone else. But it's wrong. So those that claim that we do have free will, I think they're invoking a metaphysical doctrine that a miracle is taking place every time someone makes a decision. So you yourself can actually notice the absence of these miracles. For instance, what is the next thought you are going to think? Well, the obvious answer is you don't know. So thoughts can do no other than arise in consciousness, and you can only be aware of them once they do. And to argue against this would be to say that you can somehow think a thought before you thought it. And not only do we not know what our next thought will be, we don't know when that next thought will occur. So let's try another experiment. Try for 10 seconds to not think the thought. Maybe I don't need 10 seconds. So all I asked you to do was to simply not think. Not only this was not in your power at all. So if you can't control what your next thought will be, or when it will occur, where is your free will? So if not from our felt sense of self, where are these thoughts coming from? Well, the answer is simple. Thoughts are the product of the neurophysical events occurring in the brain. And neuroscience is replete with evidence that points to this. So functions of the mind are correlated with impulses of interconnected neurons, as we detect by EEG and fMRI machines. Various psychoactive drugs from psilocybin to caffeine can affect personality and the content of thought. And then you can have damage to the brain by trauma surgery, tumours and strokes that affect isolated faculties of the mind, so such as speech or memory or the ability to recognise faces. And there has never ever been any evidence of the mind that's been able to act independently of the brain. So things like ghosts or spirits, the afterlife or reincarnation. So it seems as though our minds are entirely dependent on the brain, or in other words, the mind is what the brain does. And over the past few hundred years, humans have come to realise that we live in a universe dictated by pervasive, constant, and unchanging physical laws. So thoughts that our minds could be free are squeezed even further when we realise that we ourselves are part of this physical universe. So you as a conscious being can't step outside the causal stream of events. At every instance, the state of your brain, and thus mine, is dependent on prior states that preceded it. And we could trace this moment-to-moment occurrence back to last second, last minute, yesterday, to your birth and beyond. So no one chooses their parents or their genes. No one chooses the time and history or environment in which they were born. Where is the freedom in that? I think the fact is, our subjective experience of free will is an illusion, and there's nothing in psychology or neuroscience, physics or chemistry that can even make sense of the claim. Now, I want to be clear that when I say that free will is an illusion, I'm not saying that choices themselves are illusions. So the experience of choosing is not a fiction, regardless of how the brain works. So it's a real neural process with the obvious function of selecting behaviour facing foreseeable consequences. So you could not be sitting in this room right now without a series of specific decisions that led you to be here. And I couldn't have written this book by just sitting back and waiting to see what happens. So our lives do course in the way they do, because of our thoughts and actions, and not despite them. And this is an important difference. So thoughts, intentions, desires, aspirations are indeed occurring, are fundamental in how we all conduct our lives, but free will isn't a part of this picture. Now, I think this subject matters more than just being an interesting topic of discussion as well. I think when you look at it, it is elegantly simple, and it actually matters. And one of the ways in which it matters is for psychiatry. It seems psychiatry is a medicine of the mind, and our common ideas about the mind are wrong. I think this has profound implications for the field, and the illusion of free will might be holding psychiatry back. So one of the ways in which it's holding us back is how the general public view mental illness. So for example, a colleague of mine recently told me the story of a 65-year-old female patient she attended to in the emergency department. So tearful, anxious and confused, the patient simply stated, "Something's wrong with me." Now, further investigation and interview with the husband has seen that for the past couple of weeks, the woman had been suffering from confusion and irritability, hallucinations and poor coordination. Now, as part of a diagnostic workup, a CT head was performed, which revealed the presence of a glioblastoma multiple, a brain cancer with average survival time of about 13 months following diagnosis. Now, when the woman was informed of these cruel findings, the response wasn't expected at all. She shed tears of relief as she said, "Thank God, I thought I was going crazy." And over the coming few days, she described her comfort in knowing that there was something physically wrong with her. So just let this sink in for a moment. This woman went from being distressed at the thought that she was going crazy or had a mental illness to relief that there was something physically wrong with her, an incurable brain tumour. Now, this woman isn't alone in her views towards mental illness. So there's a study conducted by the neurologist John Stone where he presented a group of people with a hypothetical case of patients going to their GP with limb weakness and asked them what they thought different diagnostic labels implied. And here are the main results from the study. Now, importantly, the diagnoses that implied the mind was at fault rather than the brain or otherwise were much more likely seen to be putting it on, mad, imagining the symptoms, not a medical condition, and not a good reason to be at work. Now, ingeniously, the authors of this study collate the results as a number needed to offend. So obviously borrowed from the term number needed to treat. So you can see, for example, whilst 3 people would have to be diagnosed with psychosomatic weakness for 1 to be offended, 22 had to be diagnosed with multiple sclerosis for the same backlash. So why is this? Why do we have to constantly try to convince people that mental illnesses are indeed real? Why do we have to constantly remind people not to blame themselves for seeking help from psychiatrists and not from other specialties, including neurology? Why do we need foundations like Beyond Blue that have been largely created just to dispel the myths surrounding mental illness? Well, I believe one of the predominant answers is free will. So if the mind is truly free, it's only logical to extrapolate that illness of the mind must also be free. So free to change on a whim, or free to change at least if one chose to do so. So in an immaterial and free mind, it seems there is nothing for mental illness to be truly grounded in. And so establishing a psychiatric diagnosis can seem like trying to plant a flag in a cloud. What is the blame for my mental illness? Well, if there's no physical pathology, it must be my mind. It must be me. So I think that the dangerous illusion of free will is invoking notions of choice into mental illness. It alone could compel one to feel true shame and ownership of their mental illness. It alone could compel one to feel that they were another person, atom for atom. They could handle their own mental illness better, or it somehow prevented from occurring in the first place. So sentiments such as, well, if I had depression, I'd snap out of it. I think this type of thinking is utterly toxic, and the illusion of free will is allowing us to treat mental illness differently to all other illnesses known in medicine. But, it must be noted, the general public are not the only ones that have this warped view of mental illness. So health professionals are at fault also. And this can be seen in our treatment of personality disorders. So in a study that was published in the British Journal of Psychiatry, it found that doctors felt that those diagnosed with personality disorders were less deserving of care compared to other people in psychiatry. Now obviously this doesn't line up with the facts. So 5 to 10% of people diagnosed with borderline personality disorder commit suicide. Now when the predominant reason that doctors and nurses gave for their less than favourable attitudes towards personality disorders was that they felt that they had the free will or freedom to control their behaviours. So indeed, we've all seen the eyes roll in the emergency department when someone's mentioned borderline. And we've all heard that followed by it's just behavioural or attention seeking. So personality disorders are less well defined as illnesses, and whose causes are largely unknown. And when we do not see causes, we insert free legal choice, and then we reflectively blame someone for those choices. Now, not only is the illusion of free will affecting how we view psychiatric patients, it's also affecting how we view psychiatric pathology itself. And this can be seen in the terminology we tend to use. So consider the terms organic depression or non-organic psychosis, or to rule out organic causes. So what do these terms mean? Well, organic is defined as derived from or related to living matter. And so when it's used in relation to an illness, it implies there is a physical cause. So therefore, when non-organic is used, it implies there is no physical cause or not related to living matter. Now, use of this strange terminology is unique to psychiatry, where we compare it to other fields of medicine. So just to illustrate this vast difference in attitude, we can compare it to high blood pressure. So like mood and psychotic disorders, the vast majority of high blood pressure have no known cause, and only known risk factors. But rather than splitting up into organic and non-organic, we split up into primary for those cases where a cause isn't known, and secondary where a cause is known. So notice that in the cases where a cause isn't known, there's no hint or flavour that anyone actually doesn't think there's a physical cause. It's simply termed primary. And in other areas of general medicine, we'll use terms like idiopathic, which can be translated to a peculiar disease, or cryptogenic, which can be translated to hidden or concealed production. But in psychiatry, we still talk about organic and non-organic, biological and non-biological. So some cases have causes and others don't. Now, do more people interpret the terms this way? No. But I think they're superficial indicators of deep and common misconceptions about brain and mind. So I think that psychiatry has been left behind. It's been stuck in the mud of centuries-old science and philosophy. And in particular, it's been stuck in the mud of mind-body dualism or substance dualism. So this assertion that there's two kinds of stuff in the universe. You've got the material stuff, like bodies and brains, and then you've got the immaterial kind of stuff. So people claim that there's an unbridgeable gap between the brain and conscious awareness, therefore there must be something else, something like a spirit or a soul stuff. Now, as I mentioned before, neuroscience is piling on the evidence that the mind is what the brain does, and there's never been any evidence of any room for anything else. But despite this, substance dualism is enduring as a predominant view to this day, and I think that free will is playing a major role. Free will would only make sense if there was some magical aspect of the mind. It would only make sense if we relinquish the mind from the physical laws of the universe. It only makes sense if we imagine the mind as somewhat irrespective of the brain. So it's not surprising then that psychiatry, which is a medicine of the mind, isn't seen as real medicine. It's practice of the dark arts, accompanied by mind reading and talking to the dead and fortune telling and so forth. It seems that psychiatry is in the game of metaphysics, and science isn't in the game of metaphysics. So if psychiatry is a medicine of the mind, and our common ideas about the mind are wrong, where does that leave the medicine? Well, in my view, the illusion of free will is forcing a gap in our picture between the physical processes and the mind. And this gap is forming a trash can where we throw all cases of mental illness we don't yet understand. Now, does it seem like a trash can? No, it doesn't. Because at the moment we feel comfortable in saying, well, the mind is mysterious, there's free will involved. But if we resign ourselves to a mind with free will, we resign ourselves to a psychiatric specialty that does not fully attempt to understand the underpinnings of mental illness. And as long as we refuse to let go of the illusion of free will, we let the mind to escape the grasp of scientific inquiry. And this is a self-inflicted handicap that I don't think we can afford to continue. So letting go of the illusion of free will can be a truly humbling experience. And when it comes to a philosophy of living one's life too, I think it presents itself as a pretty strong candidate. So, in the words of Charles Darwin, this view should teach one profound humility. One cannot take credit for anything, nor should one blame others. So in other words, I can't take the credit for having the brain and circumstances that led me towards being a doctor, any more than I can blame someone for having the brain and circumstances that led them towards drug addiction or homelessness. And not only can letting go of the illusion of free will be personally transformative, it can also transform psychiatry. So as we've seen, it can help combat the stigma of mental illness. It can help prevent the shame that mental health patients feel about themselves. And I think that it can help propel a scientifically clear and focused psychiatry into the future. Thank you.
Stephen, let's take one or two points. One just
Two main observations. I think there seems to be this assumption that lack of the illusion of free will means a lack of moral responsibility. And I think you have to establish the preconcept. Maybe it is illusion, but the choice, even though it's an illusion, that's the personality, that's the choice, and the personal responsibility comes along with that. And talking about these things in illness and trying to not blame people, I'm actually more of the opposite trend, where people blame their behavior on having mental illness, where, oh, it's just my bipolar, my wife, it's just the bipolar, it's just the addiction. And I think that's a very dangerous thing, where I think there's maybe a high profile case, a alleged murder case, where the parents go, well, this person, had the mental system failed this young man, who then the baby-faced killer and actually stabbing someone. Well, maybe if the person actually has a severe personality or psychopathy, yes, it's in the DSM, but having that does not absolve moral blame, and I think we should not disclose that.
Well, I think the legal system can still stand on its own without the idea of free will. So you still have central tenets like separating someone from society with technologies. You've still got rehabilitation of an individual, and you still have behavioural norms that we expect in society that can deter others from causing that crime. So I think that, if we talk about no free will, we're not just going to let the prisons open the doors and everyone run out. There's still going to be standards of behaviour that we expect, and we can still, punishing people can still be the most passionate thing we can do for the whole of society, but free will doesn't have to be a part of that picture. And Sweden's actually a good example of this and how their legal system is set up. But I'll sort of leave it there, but if you want to look up the Swedish legal system.
So I think you were next.
Do I comment on the difference between freedom from cause and freedom from constraint? The latter being, I think, what we generally mean when we feel like we have free will. It doesn't necessarily mean that I have been caused to do things, but I feel like I could have done otherwise, and I feel like that opens a bit of a window wherein sometimes mental illness can be quite constraining.
Yeah. So that's the philosophical view of entitlement to free will. So that if you want to do something and there's nothing that you otherwise will restrict you from doing that thing, then that's all the free will you need. So if I have a drink of water and I drink the water, then that's free will. That seems to have changed the definition of free will, I think, and how we all generally view free will, we carry free will. And that's what we generally view free will as like a study. We feel that we're another person, atom for atom, that there's still some extra part of us that chose a different course in life. And that's an illusion. So compatibilism is something else, and I think it's changed the definition, but unfortunately I didn't have time to talk about that in sort of 18 minutes.
We'll take one more because I'm aware that people will have to get away to annual general meetings and stuff. I think you'll have the next.
I wanted to say that luckily psychiatry is not just science. For example, WHO says clearly that we need to use a bio, psycho, social, and spiritual approach. So I found that the spiritual dimension plays a major role. And for example, the medicine, psychiatry, science, and art, for example. So I think that was the spiritual dimension.
On that comment, we'll just finish. I have really enjoyed hearing the four speakers today, and I think it was a fantastic